Everybody, thank you for joining us for our Aetna Medicare product update for 2014. On the line, we have Jennifer Brown, who is the broker liaison for Aetna Medicare. If you have any questions during the webinar, please type them in the question box, and if we have time at the end, we will have Jennifer answer them for us. If we do not get to them, we will be able to answer them directly via email after the webinar. So Jennifer, I'm going to go ahead and turn it over to you.
Okay.
And let me know when you get, there you go.
Okay. You can see the screen okay?
Yes.
Perfect. Okay. Well, thank you, everyone. Thank you for allowing me to come in and speak with you regarding our 2014 Medicare products. I am a broker liaison for the Southeast region, and I support URL and Agent Pipeline. So we're going to cover today a little bit about Aetna and some tools and resources that we have available for you, and some tools and resources we also have available for your members once they become an Aetna Medicare member. We're going to cover some product information in a handful of states, and at the end, if we have some time, we'll definitely answer some questions for you, or we'll send them over to you via email afterwards. So exciting news, tomorrow starts AEP. So all this information that I'm sharing with you is in a couple different places if you want to look for it after the presentation is done today. You can find a lot of the information out on aetnamedicare.com. You can also find the information within Producer World, and I'm actually going to show you Producer World today so that you are familiar with it going into the AEP season. A little bit of background about Aetna. I'm not going to spend too much time on this because we have a lot of product to cover, but we have been in this business for a long time, and I know most of you already know that. We've been in the insurance industry alone for 163 years and in the Medicare business for 40 years. And I like to equivalent that if you think about generations of families. Think about how many generations 163 years covers. You know, your parents, your grandparents, your great-grandparents, and so on and so forth. So by selling Aetna, it should give your clients a lot of peace of mind because it's a company that's been around for a long time. And I think as you see some of the stuff I'm going to share with you today, some of the tools and resources that I'm going to be showing you, we're really in it for the long haul. We're really trying to engage those members to retain them on your book of business, and we're also trying to make sure we're giving you the tools and resources that you need to actually make it easier to do business with us. So with that being said, let's talk about how many people a day are aging into Medicare. There's almost 10,000 people a day aging into this business. And again, when I think about the people that are aging in, you have to think about they're the baby boomers, those people that are very technologically savvy in comparison to some of our current and past Medicare members. So when we do go through the tools, you're going to see that we're really gearing our tools and resources towards those members who are aging in and trying to engage them and making them more independent. One of the things when I travel and get to do training, we talk a lot to the members, and you know, I'm sure this is why you guys do the business that you do in the Medicare industry. But the one thing I hear a lot from seniors is they never want to be made to feel old or dependent upon someone. So these baby boomers, these folks aging in, are definitely that group of people. They're very independent. They've planned well financially, and they're very savvy, and they're very much informed in regards to the healthcare reform and all the things going on with the insurance industry. So again, going back to Aetna as a leader, you can see here just by the sheer numbers that we're showing on the screen, we have millions and millions of members in our different divisions that Aetna offers. We have over 1 million members in Medicare alone. We have over 22 million medical members, over 14 million dental members, and over 13 million pharmacy members. So definitely a leader in the industry. It's a name people know and trust. Not only is Aetna a name that people know and trust, but we do try to co-brand with other entities that are household names and trusted brand names. And one of those things that we do co-brand with is one of our standalone prescription drug plans. It's a CVS pharmacy plan. And being between the Northeast and Southeast, where you guys are all located, you're probably very much like me, where I can walk out my door within a couple of miles of my house in any direction. There's a CVS pharmacy. And people trust CVS. It's convenient. It's trustworthy, and a lot of times the pharmacists are very knowledgeable and make sure that those seniors are on the right medication and that their medications aren't interfering with one another. And although we're not going to talk about Medicare supplement or our ancillary or complementary products today, we do underwrite our MedSup and ancillary products through American Continental and Continental Life, also trusted brand names. We have some of the top financial ratings in the industry. You can see here we have A ratings with the AM Best, Moody's, Standard & Poor's, as well as Fitch. We're also very proud of our 3-star rating and our current star rating. And right now, We actually have 98% of our current Medicare members on plans at 3.5 stars or higher. Some of them are as high as a 4.5 star. And then none of our star ratings nationwide fall below a 3-star rating. So, it means that we're doing right by the member, and the member is actually taking good care of themselves or getting all of that preventative health care that they should be getting. What you're looking at here is our Aetna way. It's what I call our Aetna value wheel. It's how we strive to do business on a daily basis through integrity, excellence, inspiration, and caring. And the people that we serve are you guys on the phones, our feet on the street, our downline agents, the people out there working really hard to get our members enrolled in the right plan. So again, like I said, I travel a lot to do trainings, and I do like talking with the agents when I'm out and about, because technically this is a screen we're supposed to say, this is how you should conduct your business as well, because you're really representing Aetna. But what I love most about my job is when I get to talk to you guys and I hear why you want to do Medicare. And I already see that we have a great group of downline agents, and we can already tell that this is how you guys are conducting your business on a daily basis. So again, what does Aetna bring to the table? What does it mean for you? It gives you a lot of confidence, or it should give you confidence, being in this industry for such a long time. And then again, peace of mind for your clients. Go back to that generation of 163 years. So think about all the people that are now Medicare members that were maybe past medical members or dental members, or now they not only have our Medicare plans, but they maybe have a final expense plan with us as well. So we're trying to get them to get all of their insurance needs by one company, by one stop. A couple of the things that I want to bring up to you about services and tools that we offer to you. First of all, most of you live in markets, the Medicare Advantage markets, and if you live in an MAPD market or an MA market, in most instances, I would say about 98% of the time, you're going to have a local broker sales representative. And I'm not sure where you're all located today, for those of you on the line, but our local broker sales representatives are local agents to your market, and they're actually Aetna employees, and they're not actually agents. They normally would not sell the product, but they're here to help you get your business up and running. They're here to help you with any questions you might have along the way. They can help you with product information. They can help you with presentations, helping you get your meetings set up and make sure they're CMS compliant. We also offer regional support, and we have a regional support in all 4 of our regions. I'm a Southeast broker liaison, so I support the Southeast states, and I also support all the wholesale partners and distributors that fall within our states. And then up in the Northeast, we also have 2 regional broker liaisons. You guys might have heard of them. They are Anne-Marie DeStanislao and Tara Shavaria. And we're all licensed agents as well. We take the Medicare certification annually, just like you guys do, but we're also here to answer your questions. And in addition to that, not only do you have your uplines to help answer questions and to go to for need-to-know information, but we also have a national broker support unit. And this time of year, I would really encourage you, if you need an answer quickly, these folks are great. They're located up in Pittsburgh. They are dedicated Medicare call center. And some of you may have talked to them. They are very knowledgeable. They can answer a lot of the same questions. And because they're a call center, they have the staff right now to really handle those calls on a quick basis. Whereas if you're trying to get a hold of one broker sales rep or one regional broker liaison in your region, it might take a while to get a phone call back. So if you're out with a member and you need a question now, these guys are the place to go, and they're very knowledgeable. They can answer the same questions in regards to licensing and commissions, certification questions. They can show you where to find the information on Producer World. They can help you order your online enrollment kits, and they can give you enrollment updates on members that you've submitted to date, not just during AEP, but throughout the year as well. This is the one tool that I really want to spend a little bit of time on, and it's not really a tool. It's a resource for you. It's called Producer World, and I'm not sure how many of you on the line are actually familiar with it, but Producer World is your one-stop shopping for all your Medicare questions, and I know that sounds a little cliche, but it really is, and it's very easy to access. Once you become licensed and appointed with us, you can access it. But this is a snapshot of the front homepage of the individual Medicare site for Producer World, and you can see that it's really organized into multiple drop-down boxes over here. And those drop-down boxes have all the information most of the time that you're looking for. This broker training presentation is out there, so if we don't cover something as in-depth that you would like it to be, you can go out and review it today. all of your enrollment information, your summaries of benefits, your benefits at a glance, your formularies, your scopes of appointments, your permission to contact cards. All of that information is out here for you to access for 2013 and 2014. You also have all the compliance information out here. There's a do's and don'ts cheat sheet out here, which is a great thing to reference, especially if you're new to the business. It's a great two-sided cheat sheet of what you can and can't do at sales events and educational events. The commission schedule is out here, so you can see both the 2013 and the 2014 commission schedule. It's published right out there for you to look at. We also have a marketing drop-down box, and the marketing drop-down box has a couple of really nice things. Not only does it have your scope and your permission to contact, but we already have Aetna and CMS approved training materials out here for you to use. We have both a sales presentation and an educational presentation already out here for you to use. We have CMS approved sign-in sheets, so if you're holding a meeting and you need your members to sign in, it's already a CMS approved document. You don't have to worry about being out of compliance. We also have a really nice video, a MAPD video sales presentation out here. And you can actually download that to your mobile laptop or iPad or whatever it is that you might take out in the field with you. In addition to that, we also have reporting, and I like to always mention the reporting because one of the things we're trying to help you do is build your business, and we can help you build your business if you know what's going on with your business. So the very bottom drop-down box is a reporting link, and it'll actually show you all of the applications you've submitted recently that are pending with CMS, so you'll actually see firsthand that Aetna's received them. We've actually submitted them to CMS and that they're pending. You'll see if they get declined by CMS, and there's a reason code as to why if they do get declined. And then once a member gets approved by CMS, it actually moves over to your active book of business. So anything that you have your national producer number tied to as an enrollment, or in the past it used to be your social security number, that's going to be on here as long as your members are active. You'll be able to see who your members are, when they signed up for the plan, the date they signed the application, which plan they're on, and when they got their ID cards mailed to them. So it gives you a little bit of independence in being able to review your book of business. And then in addition to the active members, it also holds your deceased and your terminated members for one full calendar year. So again, a nice way to manage your book of business. They come up in a crystal report, but you are able to export all these reports into an Excel format. So to get to Producer World is very easy. If you don't have it bookmarked already, you can go to Aetna.com. You can log in if you've already registered with us. I'm sorry, go to Aetna.com and click on Producers. And then you can log in if you haven't already, if you've already registered. And if you haven't, there's a place to register. And it's about a 4-step registration process. It's very easy. And then when you get in here, you just click on the individual Medicare tab, and all this home page will show up just like you see it here. So I would encourage you, if you're not familiar with it, to get familiar with it. All the information out here, especially if you sell in one market, typically most of the time, most of these documents can be saved as a PDF to your local computer. So if you're taking a laptop out and you don't have Wi-Fi access, you can save these documents as a PDF, and you can always have access to the product information. One of the other things we do quite often, and most of you are probably get these already, is our broker alerts and our newsletters. And if you're not getting them, it just means your email address is not up to date with us, or you've chosen to unsubscribe. And I would encourage you to, if you don't have time to read them, have a folder designated for these types of broker alerts. I know this time of year you guys get bombarded with them. But we also send you information not on the Medicare business, but healthcare reform, Obamacare, the exchanges, all the different things that are going on. If CMS has an update and we want to get it out to our broker population, it's going to come out in the way of a broker alert. So please make sure you're reading them, at least glancing at them, to make sure you know what's going on, especially during the AEP season if they're Medicare related. Two of the tools that we actually have here that we feel are really good tools. In fact, I've seen these both work, and I think they're excellent tools. Some of you may already use them. The first one is an iPad enrollment app. It was actually on hold for a couple of weeks due to an iOS 7 update that Apple ran, and our link is now compatible with it. All the quirks have been worked out, or kinks or quirks or whatever you want to call them. And it is based for the iPad only, so it won't work on any other types of tablet. But the nice thing about the iPad enrollment, both of these apps actually are nice for two reasons. One, they eliminate paper. Two, they eliminate 48-hour violations, because once you hit submit, they've uploaded into our system on a nightly basis. And three, the other thing is if you've ever been subject to faxing an application in and we can't read it for whatever reason. The fax didn't come through clear, your handwriting wasn't very legible, and all of a sudden you submitted a member, and now you're trying to track it down because that member didn't get tied to you. Both of these applications, these online types of electronic submissions, have unique credentials tied to your national producer number. So as soon as you log in, that member is tied to you. There is no more keying error on our side for whatever reason. So a couple of really nice things about submitting electronically. The iPad app, first and foremost, like I said, it's available only with the iPad 2 or greater. You do not have to be connected at the time you're out in the field. So if you go out to a member's home, and a lot of the older members don't have Wi-Fi in their home, you can actually take the application right on the iPad itself. It's already a CMS-approved app, and the member just signs it with the stylus or their finger, whatever you have with you. They can just sign literally right on the iPad itself. And if you're not connected, it goes into a pending applications bucket or pending applications waiting area. And the nice thing is you have to submit this iPad app within 24 hours of taking the application. And that's important because if you don't, if you wait longer than 24 hours when you go to submit it, it will be gone. It won't be there. So you must connect within 24 hours of taking the application. And once you connect, it's going to say you have 5 pending apps in your pending bucket. Would you like to submit them now? You click yes. For each application you submit, it's going to give you a confirmation number that it's been submitted. That confirmation number is important. That's what you're going to write on your scope of appointment. Because as good as this is, we still require a scope of appointment with both of these. The scope of appointment, you write in the confirmation number, and you can fax it or email it into us with the confirmation number on it, and we match it up with that member's enrollment. You can give somebody that confirmation number on the Aetna side, and we can look up that member's information. We could tell you their member ID. We could give you where the application is at. We can make sure that you're tied to it, which you should be because it's already done with the iPad enrollment. The other thing is with our POET tool. Our POET tool is our producer online enrollment tool, and it's a little bit different in the fact that you have to be connected at the time you do the enrollment, and it's compatible with anything that has a browser because it's a browser link, a HTTP site. So we set up credentials for you on POET, and you have to be connected at the time you take the app. Again, you do have to have a scope of appointment with this, but again, it eliminates, it's automatically tied to you. Once you hit submit, it is uploaded into our system. We upload nightly into our database, and you can, on both of these, the confirmation number looks very similar. You can save the confirmation as a PDF, so you actually have a summary of the application for your own records, and you can email it to yourself and or your client. So it gives you some nice options. The other option with the POET is that we do have a lot of agents that go out into the field with a paper application, and they take the paper app just as they always have in the past, and they leave the member's home. Here's your copy. Thank you so much. And they come home at night, and they log in, and they enter their apps electronically right on their home computer at night. So if you go out during the day and you have 3 apps that you wrote for the day, you can come home at night, put them in. As long as you do it before midnight, it'll upload that same night, and we can see them in our system the next day. So not only do you have the paper copy, but now you have the electronic submission with the electronic confirmation number as well. So both of those are options for you. They're really nice options. A lot of you are trying to get out of the paper business, paper shuffling from your trunks. So if you're interested, you can request those by either calling, or you can request them right through URL, and they can send them up to us, okay? In addition to the electronic submission, we always have DocSign available. You'll notice that Aetna is getting very much out of the business of sending you provider directories and pharmacy directories because the electronic age, if you will, has really taken its place. So most everybody has a smartphone. I don't know that they make non-smartphones, but you can look right on your smartphone or your tablet or your computer on AetnaMedicareDocFind.com, and you can look up any participating PCP, specialist, or facility within our Medicare network. The next thing there that you'll see is the video and sales presentation. I already hit on that. That's the one that's out on Producer World under the marketing materials. It's a CMS-approved video for the MAPD presentation. It's really a great presentation. If you have 5 or 10 minutes in your day, today or tomorrow, I would go out and take a look at it. It gives you a lot of good information. And then lastly, we also have a print portal, a marketing on demand print portal. And this is a little bit different than the material that we provide to you at no cost on our website. The print portal, you must be current year certified to order material, and it really is a CMS library, approved library of marketing materials, and they're very nicely well-made, well-put-together professional materials. You can customize with your name or your agency information on it. They have things out there like print ads, table tents, Medicare 101 brochures. They have AEP flyers. They have lock-in flyers. Thank you cards are out there. If you want to write an Aetna thank you card, you can order thank you cards and personalize them. And the nice thing about this is really what your business demands is what you have to order. You can order 1 document or you can order 5,000 documents. It really just depends on what the business demand is and what you're looking for. Of course, the more bulk, more items you order, you get it's cheaper per piece. So if you don't know what it looks like, request access to it. It's very easy. It takes about a week to get access, and there's no charge for access and there's no charge for looking. You can always go in and just take a look around. So moving on to what we have available for you, this is what our members get when they become an Aetna member. And I like to show everybody this because sometimes it's nice to know what's happening once you sign that application and it's submitted, then what happens. So first of all, as you all know, we give them a welcome call, and it is a confirmation call to say, hey, we have your information. This is the plan you enrolled in. And we confirm that those things are accurate. We answer any questions that they might have about their plan, and then we let them know they also have access to a new member website, which is what you see over here, and I'm going to show you the tools in that in just a second. And then we also remind them that they have access to registered nurses 24/7 with any health-related topic questions that they might have. So this new member website is for the new members, and once they come out here, it also welcomes them to Aetna, and it tells them about some of the tools and some of the things that they have available to them as an Aetna member. One of the things they have access to within the member website is Aetna Navigator. And the Aetna Navigator is a personalized health calculator, if you will. They can go in, they can print out extra ID cards in here. They can actually see their benefits, like a summary of benefits, so they know what type of copays they have, what their out-of-pockets are. Do they have vision in their plan? Do they not? They also can see their explanations of benefits and their claims history for the past 365 days. So everything is electronic on here. So if they don't have the paper or they've thrown something away, they can always access it through here. They can also do the same thing that you can do in regards to looking up their own doctors and specialists through DocFind. They can input their own prescriptions in our formulary finder and see what the cost is associated with their prescriptions. And then they also have a member payment estimator, and that's really a nice feature for members who are having any type of procedure done. It takes the guessing work out of the cost. So they can put in, I don't know, knee replacement, hip replacement, whatever it might be, and it's going to show them an approximation of what the plan's going to pay versus what the member is going to pay and what their plan allows for. So it does help them eliminate some of the guessing work. It gives them a little bit more peace of mind to know what that procedure is going to cost. And in addition to the website, we also, of course, have designed some mobile apps for them as well because, again, remember, these are the more technology-savvy members that are aging into this industry. So not only do we give them the website, but we also give them the mobile applications as well. So they can do the DocFind or the formulary finder on their mobile phones. And then the nice thing is, if you guys have never heard or seen this, iTriage. iTriage is a nice symptom-to-provider type of application. Somebody's not feeling well and they don't know what's wrong, they can go to iTriage, they can put in their symptoms, and it kicks back out to them what they think is wrong, so which is nice. So, it could be anything from an earache to, maybe some type of mild heart attack or stroke or who knows, shortness of breath, numbing of the arms. And then it shows them by the My Locator in your phone all the different places in the area that they can go to get help. It'll show them walk-in clinics, minute clinics, urgent care facilities, hospitals, any place where they can get help for what they think that what type of sickness or illness that they have currently. And, I think it's great for anybody who's not in Medicare to have something like that, especially if you travel a lot or if you live in a big city and you end up on one part of town that you're not familiar with. It's a really nice tool to have. And lastly, Aetna does have a broker front runners reward program, and it really is just that. It's a rewards program to say thank you to you guys for doing a great job for us, for getting your members enrolled in the right plans, and just doing right by your members and by Aetna, and it's really a thank you. And to become a front runner for 2014, you have to sell 10 or more individual Medicare plans during the AEP season. And that can be a combination of MA, MAPD, or PDP, or it can be all of one. Has to be a minimum of 10, and those 10 have to stay on the books throughout the disenrollment period, so throughout February 14th. So as long as you have 10 members that you wrote during AEP and they stay on the books, you become an Aetna front runner. And with that, you would get a communication from our marketing team, probably, I would say, end of March, first part of April, and they will let you know that you've become the front runner. And if for nothing else, I think this first bullet is worth it, just for nothing else other than this, is that we actually pay for your certification the following year. So if you're a 2014 Aetna front runner, we actually pay for your certification for 2015. So we take your NPN, we input it into our certification site. So when you go to register to certify for 2015, when you go to check out through AHIP, it's going to say you owe $0. You don't have to break out your own credit card for AHIP. I think that in itself is worth being the front runner. But in addition to that, you also get first-to-know communications. So all those broker alerts and newsletters that we talked about, a lot of times our front runners will get those beforehand, before everybody else does. You also get priority ordering of your enrollment kits. So before we send out the broker alert that says, hey, you can order enrollment kits now online through Producer World, we've already reached out to our front runner population and said, yes, we're ready for your enrollment kit order. You get to place your order first. You get a lot of invitations to special events that are hosted normally within your region or within your state. Some of these can be golf events or tennis events, depending on where you live. But a lot of times, more than not, you'll actually get an invite to do a broker roundtable, which allows us to get feedback from you about where you think our plans are strong and where you think our plans are weak and what your members are saying about our plans. And that really helps us try to provide better plan data and benefits for the following year. If you want to go ahead and go online and do continuing ed through Kaplan Insurance Online, we give you a discount to do that. If you want to purchase anything at Staples Online, you also get a discount for that as well. And then lastly, every year we send out some type of signage. And every time I try to tell people what it is, it changes. So I'm going to just say every year it changes. We've had window clings, we've had posters, we've had table tents, we've had placards. But every year we send you out a certain amount of signage that says, hey, you're an Aetna front runner and we appreciate it. And it allows you to be able to showcase that at your office as well. So with all that being said, I hope you guys see that we really are working hard to make it easy for you to do business with us. We're trying to give you all the tools and resources that you want and need. We've tried to give you a couple of different ways to submit electronically through POET and iPad. And then again, like I said, we want to make sure when on your book of business. So we're trying to give those members the tools and resources that they need also, you know, to be in today's technology world, but also to make them feel more independent so they don't have to call you every time something comes up. So hopefully you see all of that, and hopefully some of you didn't, I mean, hopefully not all of you knew all of that, or that was a lot of talking for nothing. So hopefully that some of that information is good information to share with you and your members. So we're going to talk about our products, but there's a couple slides yet before we get to our actual products. One of the things that I don't think I mentioned earlier is right now we have our Medicare Advantage plans in 20 states plus D.C. We also have our PDP in 50 states plus D.C. And again, even though we're not talking about our Medicare supplement or complementary or ancillary plans, we do have the MedSup in 43 states and the complementary plans in 28 states. We are going to talk about a little bit different, the differences between the HMOs we offer. Evidently, there's been some confusion in the past, so this slide was put in there to eliminate any confusion. Aetna sells both HMO and PPO plans in certain markets, and there are differences between HMO plans from market to market. We offer both a traditional HMO and an open access HMO depending on where you live. So you don't get to choose which type of HMO plan you offer. It's already predetermined for you. But just so we can knock out any questions about what the differences are, the traditional HMO requires the PCP, and that PCP actually coordinates all of your visits going forward. They're the ones that write the referrals to your specialist. Whereas if you are in an open access HMO area, you still always have your PCP, but they're not required to write referrals. So that Aetna Medicare member can go to any in-network Medicare provider. They don't have to get a referral from their PCP, and that's probably the biggest difference. But I just like to make a note. It's already predetermined. You don't get to choose which one you get to offer your members. And then, of course, we have the PPO plans, which members can go out-of-network if they choose. Of course, it's at a higher out-of-pocket cost to them if they choose to do so. A little bit about our prescription drug plans on both our MAPD and our PDP markets for 2014. On both of these types of plans, MAPD and PDP, we use 5-tier formularies. The 5-tier formularies include both brand and generic drugs within the formulary. Most of our plans offer a $0 deductible, providing first dollar coverage on the Part D medications. And most of our plans have a pretty robust formulary. I think our generic tier formulary, where it says 800 Part D drugs on the generic drug tier, that's important. It's 100 of the most commonly used drugs, but to have 800 on your generic drug tier, that's pretty impressive. One of the things I like to point out is a little bit of a gray area with the formularies, and it's a bullet down here if you're following along on the screen. If you're looking for a brand name drug on our formulary and can't find it, chances are that means that that brand name drug has an exact chemical equivalent available in the generic form. And if that's the case, then the generic will be listed on the formulary, but the brand name will not. So the example that they give here is Zocor. If somebody's looking for Zocor, they wouldn't find it because on the formulary we do have an exact chemical equivalent in generic available, which is simvastatin. And that's what you're going to find on the formulary in lieu of the Zocor. Okay? For 2014, I wish they would have highlighted this and bolded it a little bit. I think this is a nice selling point for our plans, and this is on our MAPD plans. Well, we have the 5 tiers on both plans, MAPD and PDP. But the 5th tier is called Select Care Tier, and it's really a nice tier because what we've done is we've taken all of our other past tiers and we put them into 4 tiers, and then we've singled this one out. This one has 14 of the most commonly used generic drugs that treat the chronic conditions of high blood pressure, high cholesterol, and diabetes. So 14 drugs on this formulary. There are 14 of the most common drugs that people use to treat those 3 chronic conditions, high blood pressure, high cholesterol, and diabetes, and they offer a $0 cost share for those drugs. Most of the MAPD plans, not all of them, but most of them offer a $0 copay on them, and most of them offer coverage in the gap on that Tier 5. So a very nice selling point. And those formularies are out there if you guys want to go out and take a look at them. You can go out to Aetna Medicare, or you can go out to Producer World and take a look at the formularies. So this is what the Part D parameters look like for 2014. Every year CMS updates these, and every year all the plans have to be at least as good, if not better, than what this standard parameter is. So for 2014, your deductible is $310. The initial coverage limit is $2,850. The true out-of-pocket is $4,550. The catastrophic cost sharing for generic drugs is $2.55, and the catastrophic cost sharing for all of the other drugs is $6.35. This graph here is just really a visual of what I just said. You can see here from left to right the $310 deductible. As you're in the initial coverage limit, you can see what the plan's responsible for versus what the member's responsible for. And as you move to the right, you can see where you're at in the true out-of-pocket and the catastrophic phases as well. So just something for those of you who are visual, like I am very visual, this just kind of helps solidify to me what those parameters are. The donut hole phase out for 2014. On generics, the plan pays 28% and the member liability is 72%. The brand manufacturing discount is 50%, and on brands, the plan pays 2.5% and the member liability is 47.5%. One of the other strengths that I wish would be a little bit more bolded is Aetna's network. And I know you guys who have been selling our plans for a while know that more times than not, doctors and hospitals and facilities are in our network. It's very seldom you'll find somebody that your member wants in our plan that is not participating in the Medicare network. It does happen. One of the nice things about Aetna's network, it's not local. It's not state or region specific. It's a national network, and it's national reciprocity, which means I can go to any Aetna Medicare participating physician, specialist, or facility that I want in any state. So not only do we have our Travel Advantage program, which helps those members who have to be out of their home service area for longer, for a longer period of time, but if I'm on a 3-week vacation and I live in Florida, but I'm over in California for a 3-week vacation, I can go see an Aetna Medicare doctor out in California, and it goes by my home plan parameters. So A lot of folks don't know that, and a lot of times in certain areas it's very regional support. A lot of our smaller carriers have gotten to regional networks, so you have to stay within a certain area to go see one of their participating physicians. But Aetna is not that way. And you can see here, again, sheer numbers. We have a huge network. We have over 1 million healthcare professionals with almost 400,000 PCP doctors and specialists. We have over 2,100 hospitals and over 65,000 pharmacies nationwide. So really there's not a whole lot of places when you travel that you're not going to find somebody that is an Aetna Medicare participating physician or facility. We have a lot of provider collaborations. There's a big listing on a producer world. In fact, if you come back through this presentation, you can actually click on this hot link right here. It'll take you to that. It's broken down by state. But basically, our provider collaborations are really just an agreement with a select group of physicians. So we all have a vested interest in this member's health care, where we provide optimal health care to this member, and it's going to be a better way to give health care. So not only can the member be happy with low copays and low premiums, they're happy with the service they're getting, and their health is actually number one, which is, it should always be this way, but provider collaborations really enforce that. And in addition to that, if in the event one of your members has a chronic condition or they're at risk for something, a high risk for something, we give them a dedicated nurse case manager to manage their health care. And that nurse case manager actually works with the member, the doctor, the specialist, the pharmacy, the pharmacist, anybody that's involved in that member's health care for whatever reason. That nurse case manager is working with all of them to make sure the member is going to the appointments, taking their blood pressure, taking their blood sugar, whatever it might be, that they're on the right medication, and they're doing the routine care that they should be getting. So a very nice addition with these provider collaborations. For 2014, you can see here's our product offering. I could show you that map. It's not very exciting when you just look at dots on the screen, but if you look here, the 2014 footprint, what you see here is all the different regions broken down by state and county, and everything in bold is a new county for us, or a new state, or a new region for us. So you can see over in Mid-America on the left in the blue. In Ohio, we exist in Ohio today, but we are actually doing an extensive expansion in Ohio. You can see all the bolded counties there. In the Northeast, most of the footprint is pretty status quo. You can see there are a few new counties added in a couple of different states, and we're actually going to talk about some of those today. In the Southeast region, for the most part, pretty status quo with the exception of North Carolina. It's the first time ever going into the state of North Carolina. We are going into both Raleigh-Durham and into the Charlotte markets. And also in Virginia, and we're going to talk about Virginia later, we're going brand new into the Richmond, Virginia area for the first time as well. And then out on the West Coast, again, pretty status quo, except, of course, you can see Texas. We are actually expanding quite a bit in Texas as well. Currently, we have 3 markets there. We have a Houston market, a San Antonio market, and a Dallas-Fort Worth market. And those bolded counties you see here are all contiguous counties of where we currently exist today. So going into 2014, we're adding 58 new counties and 132 counties nationwide with a $0 premium plan. So again, I think you have to think about, growth and where we're going and how we're going into some of these markets with a low premium, if no premium. So very competitive. There is one change into, it says our product offering, and I don't know that I agree with that statement, but there is a change in our commission structure for our standalone prescription drugs. And it really is that our CVS plan, we're offering our CVS plan and our Premier plan for our standalone PDPs. The CVS plan is not going to be eligible for new business commissions. So if you write a CVS plan for a 2014 effective date, it's not going to be commissionable. It's only going to get renewals. Okay? Whereas if you write the Premier PDP plan, it is eligible for both new business and renewal commissions for the year of 2014. And there was a broker alert that went out on that about a month ago. So probably not a surprise to most of you, but maybe a few. With that being said, of course, we just recently completed our acquisition of Coventry. And Coventry actually has 2 nice PDPs within their Medicare portfolio as well. Because our acquisition was done so late in the year, these are actually, we're operating as separate entities for 2014. But Coventry has 2 PDP options you see here, the Part D Essentials plan and their Part D Premier Plus plan. Both of those plans are eligible for new business and renewal commissions for 2014. So in the event you're going to market all those plans, both Aetna and Coventry, You'll just want to make sure that you're ready to sell with both entities, both licensed, appointed, and certified within both. Okay, so with that, let's move on to some trainings of the states. We're going to start up in the Northeast. We're going to go to Delaware first. We're going to cover Delaware, New Jersey, and Pennsylvania here, and then we're going to move on to the Southeast region and cover Florida, Maryland, D.C., and Virginia. So let's start with Delaware. One of the nice things about this training presentation, I like to point this out because it's a new layout for this year, is we've really done it to try to help you guys. If you have a question and you want to glance back at this, so we put the counties, our markets we're in on the left. We have the network strengths here in the middle, and then we have plan highlights over here. And then as we go into the next couple of screens, I'll show you some of the other nice consistencies across the board as well. So in Delaware, you can see we do have some expansion going on there. We have about 114,000 Medicare eligibles. The seamless multi-state network, anyone that lives in Delaware can use providers in Pennsylvania or Maryland or any U.S. state, as we just talked about, that national reciprocity for our Medicare network. Our network includes St. Francis Hospital of Wilmington, Christiana Hospital, and Alfred DuPont Hospital as well. So you can see here, this is our expansion county in Delaware, is Kent County, and we offer 2 HMO plans here. The first, some of the things I wanted to show you about this presentation is we have the CMS plan ID number here for you. So if the plan numbers match in a different county, it's the same plan. And we've added if they are traditional or open access HMOs, so there's no question. These are both traditional HMOs. If they were true open access HMOs, they would say open access HMO. And then we've also given you the star rating if it's available. Some states don't have a star rating yet. So we try to do a little bit of extra effort here for you guys so you actually know what you're selling. So let's talk about the standard HMO plan first on the left. It's $38 a month. It's a $0 deductible. It has a $6,700 out-of-pocket max. PCP visits are $10 and specialists are $50. Inpatient copays are $275 a day for days 1 through 6. Your home health care is a $0 copay. Outpatient copays are going to vary depending on the service you have at the time. They're going to range between $0 and $300. Your ambulance copay is $300. Emergency room is $65, and urgent care is $55. Your labs and your routine x-rays are also going to vary anywhere between $10 and $50. Your preventative care is going to be a $0 copay. This plan also has a hearing aid allowance in it, which is $500 for every 36 months, and an eyewear allowance, which is $100 for every 24 months. It includes our health and wellness program, which is our Silver and Fit gym membership, and we'll talk about that in just a second. This one includes prescription drug coverage with a $0 deductible and Tier 5, those select care drugs covered in the gap. The Premier HMO plan over on the right side here is $122. Has a $0 deductible with a $6,700 out-of-pocket max, $5 PCP copay, and $35 specialist copay. Inpatient is $205 a day for days 1 through 6. Your outpatient copays, again, will range between $0 and $300. Ambulance copays are $300. Emergency room is $65, and urgent care is $55. This one, your labs are going to vary between $5 and $35, and your routine x-rays will vary between $5 and $45. This one also includes preventative care, the hearing aid allowance, the eyewear allowance, the health and wellness benefit, and prescription drugs with a $0 deductible and Tier 5 covered in the gap. On both of these plans, you can offer the Advantage Dental Rider listed there for $29.80. So before I move on, a couple of things. First of all, the optional riders, sometimes you'll see just one and sometimes you'll see two depending on what the plans are being offered. They're always going to be an additional premium, and they are not commissionable. I get that question a lot. So these optional riders are not commissionable. When you're actually enrolling your member in the plan and writing the application, if the member takes the optional rider at the time and they choose later not to want it, they can call member services and they can cancel it at any time. And on the same note, if they don't take it up when you're writing that initial application, enrollment application, they can call member services anytime and add it. So just a side note so you know that as you're going to meet with your members. Some consistencies through all of our Medicare Advantage plans, through every county in every state that we offer our MA or MAPD plans. Our preventative care is always a $0 copay. That does not change from plan to plan. It's exactly the same. The other thing that does not change is our health and wellness program. We always offer the Silver and Fit gym membership to our members, and you can always log on to silverandfit.com. It's all spelled out, silverandfit.com, and you can put in your zip code or your county, and then you can find the participating gyms in your area where those free gym memberships are offered. So just a couple of consistencies as we go through there. Moving into Newcastle, again, you can see you actually have the same two plans being offered in Newcastle County. You can see here in Kent was the 003 and the 006. And in Newcastle, you actually have those exact same plans going through there. I'm more than happy to review these again once we're done. If anybody has questions, I'm trying not to go through the same plans more than once because I know you guys have some time here. Sorry. I know you guys have a lot to get ready for tomorrow. So again, your star ratings, the optional riders, everything's listed for you here that you can offer with those particular plans. In Newcastle, however, they do also offer a PPO plan. It's $181 a month. It is a 4-star PPO. It has a $500 deductible. It has an out-of-pocket maximum of $6,700 in-network or $10,000 out-of-network. PCP visits are $15 and specialist visits are $40. Inpatient copays are going to be $275 a day for days 1 through 6. Home health care is a $0 copay. Outpatient copays will range between $0 and $300. Ambulance copays are $300. Emergency room is $65, and urgent care is $55. Your labs are going to range between $15 and $40, and your routine x-rays are going to range between $15 and $45. Again, you have preventative care, the hearing aid allowance, the eyewear allowance, the health and wellness benefit, and prescription drugs with a $0 deductible and Tier 5 covered in the gap. We don't offer those supplemental riders on any of our PPO plans, so you won't ever see them on a PPO. Statewide in Delaware, we offer our CVS plan for $31. It has a $310 deductible across all 5 tiers. Of course, the preferred pharmacy on this plan is CVS. If you choose to fill your prescription at CVS, you get a little bit of a break on your copays. You can see here the differences are at CVS, your copays are $2, $36, $95, 25%, and $1. And if you go to any of our other network pharmacies, they're $5, $45, $95, 25%, and $4. And there is no additional gap coverage on the CVS plan. And I want to point out, too, as you go from state to state, the CVS plan is the same CVS plan in Delaware as it is in Florida. The difference is really what we offer the plan to our members at. So in some states it's $31, some states it's $35, but they all include the $310 deductible across all tiers. None of them have additional gap coverage. So I just like to point that out. We're not going to do that on each particular state. The benefit is the same. The copays may vary. Okay. The Premier PDP plan is $121.40 in Delaware. It has a $0 deductible across all tiers. You can fill it at any participating network pharmacy. Again, your copays are $4, 25%, 44%, 33%, and $1. This one offers that Tier 5, the select care drugs, covered in the gap. We're going to move on down to New Jersey, and New Jersey has quite a few plans. It's divided into both northern and southern New Jersey. The network includes Cooper University Hospital, Virtua, and Atlantic Health System. Again, that national reciprocity or seamless multi-state network is in place, so you could live in New Jersey, but you could still go to Pennsylvania or anywhere else along the borders to a participating Medicare physician. So we're going to start with our expansion areas in New Jersey, and you can see here it's Hunterdon, Somerset, and Warren counties. This one we're going to go into this market with a 3.5-star traditional HMO at $44. It's got a $0 deductible. It's a $6,700 out-of-pocket max. PCP copays are $15. Specialist copays are $45. Inpatients $275 a day for days 1 through 6. Home health care, again, is a $0 copay. Outpatient copays are between $0 and $300. Ambulance copays are $300. Emergency room is $65, and urgent care is $55. Here, your labs are going to range between $15 and $45, and your routine x-rays are going to range between $15 and $50. This one has preventative care and your health and wellness benefit. You'll notice there is no hearing aid or eyewear allowance in the plan. It has a $0 deductible with your prescription drugs and Tier 5 covered in the gap. You can offer the optional riders listed here for that premium in addition at the time of enrollment if you wish. In Bergen, Monmouth, and Union counties, we go in with 2 different types of HMO plans. They're both open access plans. The one on the left is the basic HMO plan. This is a true Medicare Advantage plan. There is no prescription drug coverage included in this plan. It's a $0 premium with a $0 deductible. It has a $6,700 out-of-pocket max. PCP visits are $0. Specialist visits are $45. Inpatient is $275 a day for days 1 through 6. Home health care, again, is $0. Outpatient is going to be $0 to $300, depending on your service again. Ambulance copay is $300, emergency room is $65, and urgent care is $55. Again, your labs and your routine x-rays are going to vary between $0 and $50. Again, like I said, even though there's no prescription drug coverage in here, you do have the preventative care at a $0 copay, and you still get the Silver and Fit Gym membership. On the Premier HMO plan, which is this one on the right, the 048 plan, it's an open access plan for $145. It has a $0 deductible with a $6,700 out-of-pocket max. PCP copays are $0, and specialist copays are $30. Inpatients $150 a day for days 1 through 8, and your outpatient's going to range between $0 and $200. Your ambulance copay, your emergency room copay, and urgent care copays all remain the same at $300, $65, and $55. On the Premier HMO, you do get the hearing aid allowance and the eyewear allowance, and you also get prescription drug coverage with a $0 deductible and Tier 5 covered in the gap. In the northern New Jersey area, in Essex, Hudson, and Ocean counties, these are expanded counties. You're going to see that same basic HMO plan that we just talked about here in the Bergen, Monmouth, and Union counties, the one that's a True Med Advantage plan only, again, is going to be available in Essex, Hudson, and Ocean counties for $0 as well, with a $0 deductible. Again, your PCP visits here are $0, and your specialist visits are $45. So I'm not going to go through that whole plan again. Just keep in mind it's that same plan. And then you also have a value HMO plan. This is one we haven't seen yet for New Jersey. It's $44 a month. It is a $0 deductible with a $6,700 out-of-pocket max. PCP copays are $15, and specialist copays are $45. Inpatient's going to be $275 a day for days 1 through 6. Outpatient copays will range between $0 and $300. Again, your ambulance is $300, emergency room is $65, and urgent care is $55. Your labs are going to range between $15 and $45, and your routine x-rays will range between $15 and $50. This one does include prescription drug coverage with a $0 deductible and Tier 5 covered in the gap. On both of the HMOs here, you can offer those 2 riders down here that you see at the bottom for the additional premium. In Essex, Hudson, and Ocean counties, we also offer an open access Premier HMO plan. This is going to look very similar to the one we just did, the 048 plan. It's $145. It's an open access plan, $6,700 out-of-pocket max, $0 PCP copay, $30 specialist copay. Inpatient copays are only $150 a day for days 1 through 8. Your outpatient copays will range between $0 and $200. Again, your ambulance, emergency room, and urgent care copays look like they're pretty much the same throughout New Jersey. $300 for ambulance, $65 for emergency room, and $55 for urgent care. The Premier HMO plan has labs that will range between $0 and $30. It includes preventative care, the hearing aid allowance, the eyewear allowance, and prescription drugs with a $0 deductible and Tier 5 covered in the gap. And then we also offer that PPO plan here. You can see right here it's $70 a month. It has a $1,000 deductible, $6,700 in-network or $10,000 out-of-network, out-of-pocket max. PCP copays are $20 and specialist copays are $45. Inpatients $220 a day for days 1 through 7. Home health care, again, is a $0 copay. Outpatient copays will range between $0 and $300. Again, you'll see the same copays for ambulance, emergency, and urgent care copays. This one does not include a hearing aid allowance. It does not include an eyewear allowance. It does have the $0 copay for preventative care, the Silver and Fit Gym membership, and prescription drugs with a $0 deductible. It also includes Tier 5 covered in the gap. We also offer a Premier PPO plan. In Florida, where I live, we don't offer PPO for this much money, but it's $197. I don't know if that's a bargain up in the northern New Jersey area, but it's a $197 PPO plan for $500 deductible. Out-of-pocket maximums are $6,700 in-network or $10,000 out-of-network. Your PCP visits here are $5 and your specialist visits are $35. Inpatient copays are $200 a day for days 1 through 7. Your outpatient copays are also going to range between $0 and $200. This one includes a hearing aid allowance of $500 for every 36 months. It also includes an eyewear allowance of up to $100 for every 24 months. It includes prescription drug coverage and Tier 5 covered in the gap. In these areas of northern New Jersey, which is Middlesex, Morris, and Passaic counties, again, we have these two HMO plans. We've seen both of these plans here. I'm just going to hit them high level. They're both 3.5-star open access plans. Again, we've seen the 045 and the 048 plans in other counties. So let's this is the basic Med Advantage plan only with a $0 premium and a $0 deductible. PCP visits of $0 and specialist visits are $45. This one does not include prescription drug coverage at all. It does include your preventative care and your health and wellness benefits. The Premier HMO plan, the 048 plan on the right, is $145. It also has a $0 deductible and a $6,700 out-of-pocket max. PCP copays are 0 and specialist copays are 30. Inpatient copays are $150 a day for days 1 through 8. Again, we've seen this plan before, so some highlights are the hearing aid allowance and the eyewear allowance are included. So is prescription drug coverage with a $0 deductible and Tier 5 covered in the gap. And you can see here on the riders, you can offer either rider on the basic HMO plan, but on the Premier HMO plan, you're only allowed to offer that dental rider because it already includes both the hearing aid allowance and the eyewear allowance in the plan itself. So I would just say pay attention to the riders as you're going through the plans because not all riders are available on all plans. We also have 2 PPO plans available in Middlesex, Morris, and Passaic counties. Again, we've seen both of these plans previously, so I'm going to hit on the highlights here. The PPO on the left, which is the 037 plan ID number, is $70 a month. It has a $1,000 deductible. Out-of-pocket maximums are $6,700 in or $10,000 out-of-network. Your PCP visits are $20 and your specialist visits are $45. Inpatients $220 a day for days 1 through 7. Again, this one includes your prescription drug coverage with a $0 deductible and Tier 5 covered in the gap. The Premier PPO on the right side here, this is your plan that is $197. You can see it has only a $500 deductible. The out-of-pocket maximums are the same at $6,700 in-network or $10,000 out. Your PCP copay drops to $5 and your specialist copay drops to $35. And your inpatient copays also drop to $200 a day for days 1 through 7. Your outpatient copays also drop from 0 to $300 down to 0 to $200 on this Premier PPO plan. The Premier plan also includes the hearing aid allowance and the eyewear allowance, the prescription drugs with a $0 deductible, and Tier 5 covered in the gap. In Sussex counties, again, here's the 2 HMO plans. We've seen them before, 045 and 046. The 045 is a basic Med Advantage plan only. It's an open access HMO plan. $0 premium with a $0 deductible, $0 copay for PCP visits, and a $45 copay for primary care visits, specialist visits. Inpatients $275 a day for days 1 through 6. Otherwise, it's pretty status quo. Outpatient, again, $0 to $300 copays. Ambulance, emergency room, and urgent care copays all remain the same at $300, $65, and $55. Your value HMO plan in Sussex County is $44. Has a $0 deductible with a $6,700 out-of-pocket max. Your PCP copays are $15 and your specialist copays are $45. Inpatient is $275 a day as well for days 1 through 6. Of course, the main difference here on this value plan versus the basic plan is that it does include your prescription drug coverage with a $0 deductible and Tier 5 covered in the gap. Again, on both of these HMO plans in Sussex County, you can offer these riders that are listed here. We also offer a third HMO plan, which we've also seen today, which is the open access HMO plan. It's plan number 048. It's $145. Highlights, again, are a $0 deductible and a $6,700 out-of-pocket max. This one has a $0 PCP copay and a $30 specialist copay. Inpatient copays are only $150 a day for days 1 through 8, and your outpatient copays are going to range between 0 and $200. Again, this one offers a hearing aid allowance and an eyewear allowance and prescription drugs with a $0 deductible and Tier 5 covered in the gap. In southern New Jersey, we have Atlantic, Burlington, Camden, Cumberland, Gloucester, and Salem counties. We offer the standard HMO plan. This is a new one. It's a 022 plan. It's a 3.5-star traditional HMO for $104. It has a $0 deductible with a $6,700 out-of-pocket max. PCP visits are $35 and specialist visits are $50. Inpatient copays will be $275 a day for days 1 through 6. Your outpatient copays will range between 0 and $300. Your labs and your routine x-rays are going to range between $35 and $50. This includes the hearing aid allowance of $500 for every 36 months and the eyewear allowance of $100 for every 24 months. Again, this one also includes prescription drug coverage. However, this one does have a $310 deductible on the prescription drugs and no additional gap coverage. In Mercer County in southern New Jersey, you can offer them the 077 plan at $66. Has a $0 deductible, a $6,700 out-of-pocket max. PCP visits will be $35 and specialist visits will be $50. Inpatients $275 a day for days 1 through 6. Your outpatient will range between 0 and 300. This one, your labs and your routine x-rays will range between $35 and $50. Preventative care is included. Your hearing aid allowance and your eyewear allowance are both included, as well as prescription drugs with a $0 deductible and Tier 5 covered in the gap. Statewide in New Jersey, the CVS plan is $35.20, and our Premier PDP plan is $138.50. So lots of different plans going on in New Jersey. And as we move down through Pennsylvania, it's actually a similar amount of plans here. And then we'll move over to Florida and then the North Cap area of Maryland, D.C., and Virginia. So you can see we have 4 markets in the Pennsylvania area. Our network includes Doylestown Hospital, Mainline Health System, Crozier Keystone Health System, Einstein Medical Center Montgomery, Lancaster General Hospital, Lehigh Valley Hospital, Hospital of the University of Pennsylvania, and Jefferson Health System. Again, they want to make sure that you guys are aware of that seamless multi-state network, that the members can go see anybody in New Jersey or Delaware or Pennsylvania, wherever they may be. So let's start with the central Pennsylvania area, and I may not pronounce all these right, but I'm going to do my best. In Berks, Lancaster, Lebanon, and Schuylkill counties, we offer 2 HMO plans. You can see here we have a basic HMO, again, a true MA plan that does not offer prescription drug coverage. It's a $0 copay with a $0 deductible. It has a $6,700 out-of-pocket maximum, $35 PCP copay, and $50 specialist copay. $275 a day for days 1 through 6 for inpatient. Your outpatient copays, again, will range between $0 and $300. And pretty consistent with New Jersey and Delaware, ambulance, emergency room, and urgent care copays remain the same at $300, $65, and $55. This one, your labs and your routine x-rays will range between $35 and $50. You can add the Advantage Dental to the MA plan only for $13.80. The standard HMO plan over here on the right, the 070 plan, it is $61 a month with a $0 deductible. It has a $6,700 out-of-pocket max, $35 specialist or PCP copay, and $50 specialist copay. Again, $275 a day for days 1 through 6. If you look at the plans side by side, they are pretty much identical, with the exception of course, the cost. The basic does not include your prescription drugs, but the standard does. And then the other variance that I see here, too, is on the complex x-rays. On the basic Medicare Advantage only plan, the complex x-rays actually have a copay versus the co-insurance that you see over here on the standard plan. So the standard, you're going to get that prescription drug coverage also with the $0 deductible and Tier 5 covered in the gap, and there are no additional riders you can add to the standard plan. There's also a Premier PPO plan here. Here it's $141. It has a $250 deductible. Again, your out-of-pocket maximums look like $6,700 in-network and $10,000 out-of-network. PCP visits are $15 and specialist visits are $50. Your outpatient is going to range between $0 and $300. Your labs and your routine x-rays are going to range between $15 and $50. This one does include the $0 copay for preventative care, your Silver and Fit gym membership, and prescription drugs with a $0 deductible and Tier 5 covered in the gap. Moving on to Cumberland and Dauphin counties in Pennsylvania. Again, you're going to see these 2 standard basic and standard HMO plans. They are exactly the same 2 HMO plans that were offered in Berks, Lancaster, Lebanon, and Schuylkill counties. So you're going to see them here as well in Cumberland and Dauphin counties. Really the main difference, as we just talked about, is one includes prescription drugs and one does not. One's $0 and one's $61. And again, if there's something I need to go back afterwards and review, I'm happy to do that. I just don't want to keep reiterating the same plans as we go through here. Also in Carbon, Lehigh, Monroe, and Northampton counties, you're going to see those same 2 plans available again, the 054 and the 070. the basic HMO, which is a true Med Advantage plan, and your standard HMO plan. This is the only thing I wish marketing would have done, is they would put all the same counties on one sheet with all the same plans, but they just broke it up a little bit differently, so different areas of Pennsylvania. So again, you have a $0 HMO true Medicare Advantage plan, no prescription drugs. And then you have that same $61 a month standard HMO plan with prescription drugs with a $0 deductible and Tier 5 covered in the gap. The PPO is also the same PPO we've seen before. It's also available in Carbon, Lehigh, Monroe, and Northampton counties for $141. Some of the highlights here are it has a $250 deductible, a $15 PCP copay, and a $50 specialist copay. This one has a $275 a day for days 1 through 6 on inpatient copays. This one also includes prescription drugs with a $0 deductible and Tier 5 covered in the gap. In Philly, you're also going to see a couple different plans here. The first one we're going to look at is that 054 plan. That's a true Medicare Advantage plan that we've already talked about. So I don't feel the need to go over that unless we need to when we're done. But this is a new plan here. It's our standard HMO plan in the Philadelphia market, which is the Philadelphia County. It is $75.50. It has a $0 deductible. It has an out-of-pocket maximum of $6,700 in-network, $35 PCP visit, and $50 specialist visit. Inpatient copays are $275 a day for days 1 through 6. Your home health care is going to be $0. Your outpatient copays will be between $0 and $300. Your labs and your routine x-rays will range between $35 and $50. It does include prescription drug coverage. It does include a $260 deductible on your prescriptions, and it does not have any additional gap coverage. Okay, and that's on the standard HMO in Philadelphia County. We also offer a premier HMO in Philadelphia County. It's a traditional HMO for $172. It has a $0 deductible and a $6,700 out-of-pocket max. PCP visits are $20 and specialist visits are $40. Excuse me. Inpatients $250 a day for days 1 through 6. Outpatient copays will range between $0 and $225. Again, your ambulance copay, emergency room copay, and urgent care copay are all the same at $300, $65, and $55. You have a $0 copay on preventative care. You have the health and wellness benefit, and on this particular one, you also get the prescription drugs. This one has a $0 deductible, and the Tier 5 drugs are covered in the gap. In southern Pennsylvania, which is Bucks, Chester, and Delaware counties, you actually have a couple of different HMOs to look at here. The first one is a basic HMO plan. It's a little bit different than what we've seen before. This one actually has a $25 a month premium associated with it. It has a $0 deductible and a $6,700 out-of-pocket max, $35 PCP copay, and $50 specialist copay. Inpatient copays will range between, inpatient copays are $275 a day for days 1 through 6. Your outpatient copays are going to range between $0 and $300. Again, true Med Advantage plan, no prescription drug coverage is included in this particular plan. The standard HMO plan here on the right is $71. It has a $0 deductible and a $6,700 out-of-pocket max. $15 PCP copay, $45 specialist copay. Inpatient copay is $275 a day for days 1 through 6. And as you look at these plans again, side by side, outside of that, the real difference is going to be in the prescription drug coverage, which is included on the standard HMO plan. It does have a $275 prescription drug deductible and no additional gap coverage. So with that said, you also have the premier HMO plan available here in Bucks, Chester, and Delaware County. It's a different plan than we've seen to date. It's $166. It has a $0 deductible. It has an out-of-pocket max of $6,700, $10 PCP visit, $30 specialist visit. Inpatients, $275 a day for days 1 through 6. It includes labs that will range between $10 and $30, a hearing aid allowance of $500 for every 36 months, and an eyewear allowance of $100 for every 24 months. This premier HMO plan does include the prescription drugs with a $0 deductible, and Tier 5 is also covered in the gap. In Montgomery counties, we also have a basic HMO and a standard HMO plan. The basic HMO plan here is $25 a month with a $0 deductible. It has a $6,700 out-of-pocket max. PCP visits are $35 and specialist visits are $50. Inpatients $275 a day for days 1 through 6. And you can see that still holds true here. The ambulance, emergency room, and urgent care copays all remain the same of $300, $65, and $55. This basic plan, of course, is a true MA plan, so no prescription drug coverage is included. The standard HMO plan in Montgomery is $111 with a $0 deductible and a $6,700 out-of-pocket max. Your PCP visits are still $35, and your specialist visits remain $50. Inpatients $275 a day for days 1 through 6. And again, your outpatient, ambulance, emergency room, and urgent care copays all remain the same. This one does include prescription drug coverage with a $275 deductible and no additional gap coverage. We also offer that same Premier HMO plan in Montgomery County as well. It's the 084 plan. It's $191 here, has a $0 deductible and a $6,700 out-of-pocket max. PCP visits are 15 and specialist visits are 40. Inpatients $275 a day for days 1 through 6. Here you're going to have a hearing aid allowance and an eyewear allowance as well. Your preventative care is included. Your prescription drugs are included with a $0 deductible and Tier 5 covered in the gap. Statewide in Pennsylvania, you have the CVS plan for $35.70 and our Premier PDP plan for $127.40. So as we move down to the southeast region, we're going to just start with Washington, D.C. We're right in the whole District of Columbia. Our network includes every hospital in D.C. with the exception of the Children's National Medical Center. In D.C., we offer an HMO and a PPO plan. You can see our HMO plan is not yet rated. It's $25. It has a $0 deductible and a $6,700 out-of-pocket maximum. PCP copays are $5 and specialist copays are $40. Inpatients $250 a day for days 1 through 7. Your home health care is still a $0 copay, and your outpatient copays will range between $0 and $275. Ambulance copay is $300, emergency room is $65, and urgent care is $60. This one includes labs between $5 and $40. It includes your preventative care. It also includes your prescription drug coverage with a $0 deductible and Tier 5 covered in the gap. You can offer either of those riders listed there below on the HMO plan here in D.C. only. The Premier PPO in D.C. is $87 a month. It's $750 deductible. Out-of-pocket maximums are $6,700 in-network or $10,000 out-of-network. PCP visits are 15 and specialist visits are 45. Inpatient copays are going to be $275 a day for days 1 through 6. Outpatient copays are also going to range between $0 and $275. This one includes your preventative care and your health and wellness benefit, as well as prescription drug coverage with a $0 deductible and Tier 5 covered in the gap. Statewide, we offer our CVS plan at $31 and our Premier PDP plan for $121.40. In the state of Florida, we're actually in 4 markets here, the Jacksonville market, the South Florida market, the Southwest market, and the Tampa area. We have a collaborative relationship with Baptist Primary Care and First Coast Primary Care and Family Care Partners in Jacksonville, as well as the Intercoastal Medical Group in Sarasota. We have an excellent network in Palm Beach and Broward counties in South Florida, and we also have a unique relationship with Cleveland Clinic and Boca Regional. We are the only MAPD carrier in Southwest Florida to be contracted with Sarasota Memorial and the First Physicians Group. And in Tampa, we offer 3 provider collaborations, one with Diagnostic Clinic, PHC of Pinellas, and also with Baycare. So if we look through our Jacksonville and South Florida market, we cover Duval, St. John's, Broward, Miami-Dade, and Palm Beach counties. We offer an HMO and a PPO plan here. Our HMO plan is Plan 019. It's a $0 premium with a $0 deductible. It has a $6,700 out-of-pocket max, $10 PCP copay, and a $45 specialist copay. Inpatient copays are going to be $275 a day for days 1 through 6. Outpatient copays are going to range between $0 and $350. Here, your ambulance copay is $335, and your emergency room is $65, and urgent care is $60. Your labs and your routine x-rays are going to range between $10 and $45. It includes a health and wellness benefit and prescription drug coverage with a $0 deductible and Tier 5 covered in the gap. Our PPO plan here is $35 a month with a $500 deductible. It has an out-of-pocket max of $6,700 in-network or $10,000 out-of-network. $275 a day for days 1 through 6 for inpatient. Outpatient copays will range between $0 and $300. Ambulance copays go back to $300, emergency room to $65, and urgent care to $55. Again, you are going to have prescription drug coverage with this particular PPO plan. However, there is a $310 deductible and no additional gap coverage. In Charlotte, Lee, Manatee, and Sarasota counties, we also offer 2 HMO plans here. The first is the 009 plan. It's $37 a month. It has a $0 deductible and $4,900 out-of-pocket max. $10 PCP copay and $45 specialist copay. Inpatient copays are $250 a day for days 1 through 7. Outpatient copays are going to range between $0 and $225. Your ambulance copay is $300, emergency room is $65, and urgent care is $55. Your labs and your routine x-rays are going to range between $10 and $45. This plan includes prescription drugs with the $310 deductible and no additional gap coverage. The select HMO plan on the right, the 023 plan, is also a $0 premium plan with a $0 deductible. It still offers the $4,900 out-of-pocket maximum. Your PCP copays are $0 and your specialist copays are $30. Inpatient copays are $250 a day for days 1 through 7. Your outpatient copays are going to range between $0 and $275. Your ambulance copay goes up a little bit to $350. This one includes prescription drugs as well with a $0 deductible and Tier 5 covered in the gap. You can offer any of these optional riders with both of these plans. We also offer that PPO plan that we offered in St. Johns, Duval, Miami-Dade counties. It's that 033 plan. We also offer it here for Charlotte, Lee, Manatee, and Sarasota. Some highlights again, it's $35 with a $500 deductible. PCP copays are $10 and specialist copays are $45. Remember that this one does include prescription drugs with the $310 deductible and does not offer any additional gap coverage. In Hillsborough and Pinellas counties, we have a similar plan here. The 009 we've already seen, so I'm going to hit the high level of this. It's our value HMO plan. Again, it's $37 a month with a $0 deductible. The PCP visits are $10 and the specialist visits are $45. Inpatients $250 a day for days 1 through 7. Your outpatient copays are going to range between $0 and $225. Your labs and your routine x-rays will range between $10 and $45. This one includes a $0 copay for preventative care. It includes the health and wellness benefit and the prescription drugs with the $310 deductible with no additional gap coverage. The Premier HMO plan, the 024 plan, this is a new plan. We haven't seen this one yet. It is offered in Hillsborough and Pinellas counties as well for $0 with a $0 deductible, $5,000 out-of-pocket max, $10 PCP visits, and $45 specialist visits. Inpatients remain the same at $250 a day for days 1 through 7. Your outpatient copays are going to range between $0 and $275. You can see here your ambulance copay goes up to $350. Your labs and your routine x-rays are going to range anywhere between $10 and $45. This particular Premier HMO plan includes the It includes the hearing aid allowance and the eyewear allowance in both. It also includes the health and wellness benefit and prescription drugs with the $0 deductible and Tier 5 covered in the gap. We also offer that same PPO plan here in Hillsborough and Pinellas counties as well, that 033 plan, the $35 a month, $10 PCP copays, and $45 specialist copays. Again, just a reminder, it has the $310 deductible on the prescription drugs and no additional gap coverage. And then in Pasco County, this is a little bit different. This is broken out separately than it was for this current year. Pasco is over here by itself. We offer 2 plans here as well. You have seen both of these plans. It's a value HMO plan and a Premier PPO plan, and they're roughly about the same price. You're going to see a little bit of variance in out-of-pocket maxes. So remember, this HMO plan is $37 with a $4,900 out-of-pocket max. PCP copays are $10 and $45. Outpatient copays are going to range between $0 and $225. This one includes prescription drugs with a $310 deductible and no additional gap coverage. The PPO plan is the same PPO we've looked at the rest of Florida. It's a 033 plan, $35 with a $500 deductible. Your out-of-pocket maxes, of course, have an in and out-of-network max of $6,700 in and $10,000 out-of-network. PCP visits remain the same at $10, and specialist visits remain the same at $45. Inpatient goes up to $275 a day for days 1 through 6, and your outpatient copays also go up between $0 and $300. This one also includes prescription drug coverage, and it also includes the $310 deductible with no additional gap coverage. So if you market in Pasco County, this is a little bit different. We don't offer a plan that has a $0 deductible on prescriptions with gap coverage. Both of these plans here have the deductible and no additional gap coverage. Statewide in Florida, we offer our CVS plan at $75 and our Premier plan at $119.60. All right, let's skip on down to Maryland here. In Maryland, we are in the Baltimore area. We actually have a very nice network up in that area. We participate with all the major hospital systems, including the University of Maryland Medical System, the Greater Baltimore Medical Center, Harbor Hospital Center, Mercy Hospital System, and the MedStar system. This year we're going from 3 plans down to 2 plans, actually 4 plans down to 2 plans. So in Baltimore we offer that basic HMO plan, very similar to the rest of the Northeast and Pennsylvania and New Jersey area with a true Med Advantage only plan. It's $19, $0 deductible with a $6,700 out-of-pocket max. It has a $15 PCP copay and a $45 specialist copay. Inpatient copays are going to range between $275 a day. They're not going to range. $275 a day for days 1 through 6, and your outpatient will range between $0 and $275. This one does include the preventative care copay of $0 still, as well as your prescription or your health and wellness benefit. You can see on the HMO plans, you can offer the Advantage Dental or the Dental Eyewear and Hearing Aid Writer for $24 on that second one. The other option in Baltimore is our standard HMO plan. It's $51 a month, has a $0 deductible. Out-of-pocket maximums are $6,700. PCP visits are $20 and specialist visits are $50. Inpatient's going to be $295 a day for days 1 through 6. Outpatient copays will range between $0 and $300. Again, your ambulance, your emergency room, and urgent care copays all stay the same at $300, $65, and $55. Of course, the biggest difference here is that it includes prescription drug coverage with a $0 deductible and the Tier 5 drugs covered in the gap. Statewide in Maryland, we offer our CVS plan at $31 and our Premier PDP plan for $121.40. In Virginia, again, we have some existing footprint in Northern Virginia, and then we're going new into the Richmond market. In Northern Virginia, we actually have 100% of all the hospitals participating in our network, including the Inova Health System. So in Northern Virginia, here's our counties: Alexandria City, Arlington, Fairfax, Fairfax City, Falls Church, Loudoun, Manassas City, Manassas Park City, and Prince William counties. We offer both an HMO and a PPO here. Our HMO in this area is not yet rated, so it's a $40 a month premium with a $0 deductible, $5,200 out-of-pocket max, $10 PCP copay, and $40 specialist copay. Inpatient copays are $250 a day for days 1 through 6. Home health care is a $0 copay. Your outpatient copays will range between $0 and $275. Your labs and your routine x-rays are going to range between $10 and $40. This plan actually includes a hearing aid allowance of $300 for every 36 months, as well as an eyewear allowance of $50 for every 24 months. It does include prescription drug coverage with a $310 deductible and no additional gap coverage. The PPO up in Northern Virginia is $77. It has a $750 deductible. Out-of-pocket maximums are $6,700 in-network or $10,000 out. PCP visits are $15 and specialist visits are $40. Inpatient copays are $250 a day for days 1 through 7. Again, your ambulance copay is $300, emergency room is $65, but urgent care drops to $55 on the PPO plan. This one does not include the hearing aid allowance, and it does not include the eyewear allowance. It does still include the $0 copay for preventative care, the health and wellness benefit, and prescription drugs with a $0 deductible and Tier 5 covered in the gap. In Richmond, we're going brand new into the 4 counties you see here: Chesterfield, Hanover, Henrico, and Richmond City. We're going into this market with a $0 premium HMO plan with a $0 deductible. Out-of-pocket maximum is $5,550. Primary care visits are $5 and specialist visits are $35. Inpatients $260 a day for days 1 through 7. Home health care is $0. Your outpatient is going to range between $0 and $265. This one includes your hearing aid allowance and your eyewear allowance. It also includes your prescription drugs with a $0 deductible and the Tier 5 drugs covered in the gap. Statewide in Virginia, we offer our CVS plan at $27.20 and our Premier plan at $125. So a couple of things I just want to touch base on before if we have time to open it up for questions. Some of the things that come standard with our MAPD plans. We've already talked about a couple of them. The Silver and Fit gym membership. If you go out to this presentation, you can see it out here, silverandfit.com. Our members can call member services with any questions on that as well. our U.S. Travel Advantage program, which is also our national reciprocity. Travel Advantage is a little bit different. It's for our Medicare Advantage plans only, for our MAPD plans. And I use the instance of snowbirds a lot because we live in Florida. So if you have somebody who's leaving their home area for an extended amount of time, they can actually continue care when they go to Florida for 5 or 6 months, or maybe they're taking care of a family member in a different state and they're going to need to keep their care up. All they have to do is call member services and let them know that they're going to be leaving their home service area for a significantly long time. It can't exceed 12 months. And we'll help them pick out a PCP and specialist and facilities to wherever they're going to be for that temporary amount of time. And then when they come back to their home area, they make another call to member services and let them know that they're home. And then they can continue to see their home PCP and specialist in their home area. In some of our markets, we offer a transportation benefit, but none of them we cover today. It's really in our Georgia and North Carolina markets. We offer a compassionate care program to our Medicare Advantage members, and it's really a hand-holding counseling service for our members. If they have any difficult decisions that they need to make health-wise or living arrangement-wise, we will make sure to try and help them make the right decisions, give them an informed decision process. In that preventative care that we talked about, that's a $0 copay for our members on all of our Medicare Advantage plans. That includes 1 hearing and 1 vision exam annually as well. Regardless of what's included in the plan as far as eyewear and hearing aid allowances, the vision and hearing exam is included in that preventative care copay of $0. We offer our prescription home delivery service with both our MAPD and our PDP plans. If you are on the MAPD plan, you pay 2 copays and get 3 months worth of supplies. If you're on our standalone PDP plans, you pay 3 copays and get 3 months. In addition to all of the things that come standard with the plans, we also offer a variety of discounts to our members if they choose to take advantage of them. We have fitness discounts through a company by Global Fit. They actually can get a discount if they want to put in-home fitness equipment inside their home, DVDs, that type of thing. We also offer weight management discounts if members want to manage their weight and their calories on Jenny Craig or Nutrisystems or Calorie King online. They can go to most retail eye centers and get discounts on frames and lenses for being a Medicare member, an Aetna Medicare member. Same with hearing discounts. If they use HearPO or Hearing Care Solutions, they can get discounts just for being an Aetna Medicare member. And again, these are things that they don't have to take advantage of, but if they choose, they can get a discount. We have different home products discounts like a blood pressure monitor, and we have oral health care discounts from Epic and Waterpik. We have a life station discount if they want to choose to put a life station alert system in their home. It's the necklace system where they can push the button if something happens. Memex offers them discounts on vocal memory aids, and they can put anything on there from take your vitamin, take your blood pressure, don't forget your doctor's appointment. It's truly for whatever they want to use it for. It's a discount. So just a couple of things before we go into licensing, appointment, and certification. I'm actually going to go through this. To be ready to sell for Aetna, you must be licensed, appointed, and certified in all the states you plan to market in, and you must be product trained. So today takes care of your product training. But the one thing I do want to point out is if you get your commissions paid to an agency, for instance, my name is Jen Brown, and I have my agency, and I live in Florida, but I market in Georgia and North Carolina also. Not only do I individually have to be licensed and ready to sell in all those states, but so does my agency. So if you put on the application an agency to receive commissions outside of you getting paid to your Social Security number, that agency has to be ready to sell. And I like to tell you all that because if you put an entity on the app that's not ready to sell, nobody gets paid on that application. You don't get paid. The agency you put on there doesn't get paid. Nobody gets paid. So all entities on the app have to be licensed, appointed, and certified. They have to be ready to sell for any commissions to pay out. And I like to tell you that ahead of time so you can go back in and check your information through Producer World. If you have any questions, you can definitely give us a call. The end of the presentation are really just some marketing and educational compliance tips. So sales tips, marketing, educational in-home visits. If you're doing a promotional event, how to stay compliant. The scope of appointments required with every application you submit. And I know you guys work with an upline, so I'm going to defer to them on how they want you to submit that application. Chances are they want you to submit it through them. But I'll let Karen confirm that here in a minute. Scope of appointment is required with all apps. Even if you do it electronically, we still need the scope of appointment. And the reason why we need that is because a few slides later, we talk about producer monitoring, and we do producer monitoring. We watch your rapid disenrolls, we watch your 48-hour violations, and we also do our member complaints. And if we reach out to you for something, and sometimes we don't get very much notice from compliance, we might get a couple of hours to get all the information back from you, just depending on what the complaint is. It's so much easier if we have your scope and your app all together, because then we're not trying to reach out to you and you're not golfing or at a baseball game or at a football game and we need it within 2 hours and you can't be there. So we don't want you to be in violation. So please make sure you include your scope of appointment with all of the applications you submit. Again, we talk about different ways to submit the apps. You can do it through the iPad. You can request credentials also through Poet. You can fax in the application. The fax number to Aetna is always on the last page of the application. This year we offer a new method, which is email. If you choose to scan and email your application in, you can certainly do that. Our servers are all secure, so you can email those apps into us. Again, I know you all work with an upline, so I'm going to defer to Karen to let her tell you how she wants you to submit those applications. But please make sure we need those apps in within 48 hours of taking them. And reminder, AEP starts tomorrow, so you can start writing business for AEP for 1/1 of 14 effective dates. The disenrollment period is January 1st through February 14th. And the very end is just really a checklist, so you can go out and take a look at it and make sure that you're ready to go. It's always comforting to know that you're 100% ready to go before you write that first app. So with that, I know I'm about out of time. I may have gone a minute over, and I apologize, but I am done, and so I'll either open it up for questions or I'll let Karen email me the questions after the presentation. Karen, are you there? Well, I guess with that being said, I will thank you again for your time and your attention today. I know she'll have a list of questions for me that came across the message board during the presentation. And again, I wish you all the best of luck during AEP. I hope you have a very successful fall. And if you need anything, we are always a phone call away. So thank you very much for your time today. I appreciate it.